So today we're going to talk about exfoliative cheilitis. So what the heck is actually cheilitis? Cheilitis means just a medical term for inflammation of our lips. According to dermnetnc.org, exfoliative cheilitis is a rare condition presenting as continuous peeling of our lips. Some may be triggered by a behavior of obsessive, like peeling or licking your own lips. So for this condition, it can affect both female and male, and the presentation is usually quite equally among both sexes. Usually patients will start to have this condition under the age of 30. So for me, I started to have this peeling of lips, this exfoliative cheilitis condition, since I was around 15 or 16 years old. So I've been managing this condition for like 15 years at least now. Sadly enough, as it's not a common condition, so the cause for this exfoliative cheilitis is not known yet, so the cause is unknown. Some of the factors that may contribute to having this medical condition, including people using mouth breathing or frequent lip licking, lip sucking, biting your own lips, and having poor oral hygiene can worsen the condition. And also there may be some bacterial infection that can also worsen the whole peeling process for the condition. So what do you usually see or what do you feel when you have this condition? So some of the common signs and symptoms for exfoliative cheilitis, we have this continuous cycle of peeling of our outer part of our lips. Interestingly, our inner parts, like more mucosal or reddish part of your lips, never get involved. So it's usually just the outer part of your lips that is called medically the vermilion part of your lips that will somehow get hardens, and then when contact with water or other liquids, it will be whitish, and then it will easily peel off. So after peeling off, the lips underneath may look more normal or reddish, but this whole process will just happen again, and then you have this thicker layer of skin that will form again, and then keep just this cycle of peeling will just keep cycling in a few days or in weeks, depending on how long have you had this condition, I believe. So usually more people have the lower lips that are involved at first, and some may have both lips that are involved. So apart from peeling of your lips, some people may have associated bleeding resulting from formation of some crust over your lips. And people usually complain of some inflammation of the lips, so the size of the lips may be enlarged compared to your usual ones. And some may have pain over your lips or some tingling sensation. I believe some people do think the most annoying part will be like difficulty in eating. You can imagine with this condition, and then it will interfere with your normal talking, smiling. So it is difficult. It's no joke for social interactions. It can be difficult at first. Some people reasonably enough that they may have some sort of mood problems as this condition worsens, and they can lead to depression or anxiety and will need further like mental health help. We'll talk about this more in later videos. So this is pretty much the condition for exfoliative cheilitis. So for the management part, usually people will use some kind of lip balm or moisturizers for keeping the lips moisturized, as most of the sufferers will have dry lips, and then drier lips seems to aggravate the peeling of the lips as well. So what will I do is I use this lip balm regularly every day, multiple times a day, and then put a very thick layer of moisturizers or something like Vaseline, Aquaphor, or CeraVe healing ointment, and then I'll just go to sleep, and then it helps to reduce the amount of peeling. So after certain years, I think it's getting easier for me to manage or to cope with this disease. I can live with a quite normal life, and yeah, so just share your comments about what works for you in the comments section. Peace.